Hi, I'm Dr. Molly with Your Goals Physical Therapy. Okay, martial artists, are you trying to improve the strength of your kick? Let's talk about how to strengthen your feet, because that will get you a much stronger kick. I don't mean like strengthen just worrying about how you point your toes and make sure you're gonna be able to keep your foot in a blade so that you're hitting your target with the blade of your foot, or being able to pull your ankle up tight. I want to talk about those of you out there that have your arches that drop. So in this video, we're going to talk a little bit about the anatomy of a foot and how important the arch is. And then we're going to talk about why, even if you know that you have the arch problem, why you can't just go on YouTube and figure this out. Why that's so complicated and you've probably been spinning your wheels for a very long time trying to figure that out. So let's talk about this. So the anatomy of the foot. Your arch is very important. And it's true, everybody's born with a slightly different height and other things. So there is some variant here. But overall, if we're just going to take this as our person, this person's arch, there's a big space underneath here. And what that arch helps do is not only when all the muscles are tightening correctly and doing what they're supposed to, helps give that person a very firm foundation for the rest of their body. It also helps them with shock absorption. So as they land, the muscles in the bottom of your feet are helping you absorb the impact of landing. That's true no matter what you're doing, whether that's walking, whether that's kicking, it doesn't matter. That's what your arch does. That's why you have it. So you have a little bit of this that can happen. You walk on an uneven surface, you have that little give, so to speak, right? For those people that have very flat feet, and let's put an asterisk on that. Some people have an arch when they're sitting, and then when they stand, they have no arch. And some people have no arch because that's just genetically how they were made, right? They were born with flat feet. So really, certain amounts of this, you really do need to look at the person and see how everything aligns. But since most people have an arch, we're going to talk about it in that manner, right? So if this is my person and they started off with an arch, but then over time, this arch has now collapsed. So again, like I said, some people have an arch when they're sitting and then none when they stand. So this would be their reality. They stood up and their arch just goes down. So what causes that? There are several things. It could be that your muscles are just overstretched and so they don't have the strength to stabilize against your weight on your foot. It could also be that you have ligaments that aren't able to do their job anymore. And so no matter how hard your muscles try, they don't have the ligaments there to support them. And of course, there could be a combination thereof. One might say, well, it's just a flat foot, who cares? But what happens at your foot affects your ankle and then affects your knee and therefore can affect your hip and your back. Because as you've seen on this model, every time I push that arch down, that shin bone starts to go at an angle, which on a person, there are people that, their shin bones are like this, but I'd say most people that have flat feet don't notice that their shins do this. No, it still corrects to go up straight, but it does stress out the inside of that knee because you figure if this is going up and it's going to meet your femur, then this one's going to still be wanting to be tilted down and your femur's going to be wanting to go up based on what's happening at your hip. So it puts a lot of strain on the inside of your knee. And that, over time, that can cause ligaments to get strained or sprained or worse, tear. It can cause medial meniscus tears. It can cause a whole host of things. Honestly, just having that extra pressure on the inside of your knee. Now, how would this affect your kick? So when you're kicking, you need to have a very strong stance leg, right? Obviously, because that's the only thing touching the ground. So if it's not strong and not stable, then you're going to have a problem getting enough strength, impact, power to go out on the kicking leg. And so if you're if your foot collapses in, now you've lost all shock absorption. So you can't spring, right? You don't have any bounce that gives on that stance leg, which can help you get a little bit more of a whip, a little bit more power, quickness. But again, if you don't have that strength to maintain that arch, you can't get that pop, right? The other thing that happens is when I was talking about your knee, if your knee is being pulled inward, then oftentimes you're going to have a problem with either straightening or bending your knee, because your body's going to adapt to try to keep that stability, and it's going to naturally lend to wanting to do one or the other, which again, for your stance leg, you don't want it wasting any energy. I don't want my leg wasting any energy on anything other than trying to kick that target. And if it's fighting itself to stay stable, it's wasting energy. So that is how just a little bit of the arch support can really affect your kick. And depending on what level you're trying to kick at, I mean, if you're recreational, then you may never notice this, but if you're trying to compete or trying to really progress in this sport, that little bit is an edge, and you don't want to lose any edges. That's important. Now, if you've been watching YouTube videos and you're like, well, I've been doing all the strengthening exercises and I don't understand why this isn't working. Our bodies are going to move in the path that are easiest for it, right? Nobody's going to spontaneously look at a video and say, hey, that person moves differently than me. I can't quite make out that form the way that they are. You're just going to move your body the way that you think it's supposed to go. And you're like, well, I'm doing what they're saying, so that has to be right. But if your arches are collapsing, there may be something going on and you're not able to actually do the exercises exactly the way that's being demonstrated on the video. You may be using muscles that they're not using. And how would you know that? Because you're just moving your body the way it's supposed to. How would you correct that? And I believe that is the number one reason why when somebody comes in and speaks to me, they're like, but I've been doing all the videos and they're like, the exercises you're giving me, I already knew about those. And I'm like, yeah, but are you doing them the same way? And 100%. That they're never doing them the exact same way. And these are well-trained athletes that have been doing this for a long time, but their body moved a certain way. And so when they looked at those videos and they looked at that stuff, their bodies are moving the same way that it is. And I don't want to say injured, because this is probably not an injury, but it just moves in a different way than the intention on that video. So that is where coming in and seeing somebody that is a movement specialist and just having them help tease out some things, you might not even be having to do exercises you hadn't heard of. You might just be tweaking how you're doing them. And all of that to say that you could be increasing your strength, your power, or your speed with that kick by just tweaking one or two things. So I hope that this information helps, and I hope you're having a good kick day. Bye.